The rapid cognitive screen was developed out of the St. Louis University mental status exam, colloquially known as the slums. When we did the slums, we found that it would pick up mild cognitive impairment as well, if not better, than any of the other screens. Our plan was to say, could we go to something that is quicker to do, but would also pick up mild cognitive impairment.
The rapid cognitive screen has been extremely useful to me, even as a geriatrician, where I tend to use some of the longer screens more frequently. If I'm in a hurry and I have somebody that maybe what I call the doorknob complaint, where I was about to walk out the door and then they say, oh, by the way, doctor, I've also noticed some of these other issues, I can use this very rapid screen. It takes just literally a few minutes, and I ask those questions, and I get a lot of information from that in a short amount of time.
There are 3 parts to the rapid cognitive screen. The first is 5 words that you need to memorize. The second part is the drawing of a clock and putting in the time at 10 to 11. And the third part is a paragraph where there is one question on the paragraph, and that requires the person to take the name of the town and place it in a state, or to take the name of the town and place it in a country, the international version.
So in the first item, you are testing delay recall, so you want them to really learn those 5 words. I asked them for a second time to practice with me the 5 words, and you can do that no more than 3 times, but it's important that you ensure that they learn and understand what you are saying, those 5 words, so in that way the delay recall is valid. Let's say this is a clock face. I would like you to put the clock numbers on it. I would like you to put the time with the hour marker saying 10 minutes to 11 o'clock.
The hour. Well, I did that wrong.
You can erase yes. Excellent, thank you.
The scoring of the clock, as has been validated, is not to look at how they do it, but to look at the final process. Basically, the important piece is that the hour markers need to fit within the full clock. Many people will get most of the hour markers in, and they will have got to what most of us would think is about 6 o'clock or something like that, and then they may put the last 2 in the right places. That would basically be inappropriate, and they would get no marks for that. Varieties of different things, including clock reversal, can occur. All of those lose you your marks for the clock part. When you come to the time, we've used 10 to 11. The important piece is the person is told the time before they start drawing the clock, and you cannot cue them. Many people come back and say, please, what was that time again? You can't cue them at that stage because this is a memory piece as well as visuospatial.
All right, what were those 5 words I told you to memorize?
Apple, tie, house, car. I forgot one of them. I don't remember what that was.
The 5 words are used because fundamentally we found that many people who are in early mild cognitive impairment actually can remember 3 words without any trouble, but when you ask them to remember 5 words, they finish up being able to remember only 1 or 2 of them.
I'm going to tell you a story. Listen to it carefully because I'm going to ask you some questions afterwards, okay? Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. What state did she live in?
Illinois.
The last item is the story. So it's a short story, and you're only asking one question, which is what stage she lived in. And that question tests for 2 things: immediate recall and executive function as well, because you are asking them to interpret the information you gave them. You ask them what state did she live in. The state is not mentioned in the story. You are mentioning the city. So that's why it's testing executive function. Well, Mr. Green, seems to me you had a almost perfect score. So this test is really a screening test, which just suggests tells us how your memory is doing, and as of based on these results, it shows that your memory is just fine.
Oh, that's good news.
All right.
Glad to hear that, Doctor.
It's fairly clear that many people with early cognitive impairment, either mild cognitive impairment or even dementia, do not have the diagnosis made by physicians. Overall, the data suggests that at the very best, 1 in 4 people who have cognitive impairment will have that diagnosis made by the time they have dementia. In the case of mild cognitive impairment, maybe 1 in 20 people will have had the diagnosis made.
My role as a geriatrician in cognitive screening is that whenever I see a new patient, that is just part of my job and what I do, regardless if the person complains of any memory loss or not. I also think it's very important to screen on a regular basis to monitor the person, and so typically I do about once a year where I'll do another cognitive screen and assess and compare to where they had been the year before. In the community setting, for other practitioners, it's still important to screen for this, because while we may not have the best medications yet to treat this, we still have a lot of interventions that we can offer to patients and families once we've secured an early diagnosis of memory loss.